basically, we have to check for the semen analysis for a male to find out whether he is able to produce good sperms, and also checking the woman whether she's able to ovulate and the tubes are patent and the uterine cavity is good enough to receive embryos. In the meantime, we need to know the compatibility between the man and the woman, whether they are able to sustain together a pregnancy to continue, or do we need to interfere to make it happen, i.e. by giving some medications to maintain the pregnancy. This is all about the modern medicines, how to be very fast, quickly of diagnosing whether the gentleman is fertile, whether the woman is fertile, whether both can have a baby or not. What I always say, to increase fertility between couples, there must be a harmony, there must be love in the relationship, there must be stress-free relationship. That's very important. There must be healthy couples. Any problems within the health of the man or a woman has to be dealt with as soon as possible and as effective as possible. The sexual relationship has to be carried out regularly and with average of 3 to 4 times a week, and avoid the timing, what I call it clinical marriage, to get pregnant, because that can sometimes delay pregnancy. So again, we have to have a loving relationship within the marriage. The other thing which is very important, which I'd like very much couples to know, sometimes by having diet control, healthy food, healthy antioxidants, environment around has to be better, avoiding all these smoke areas or smoking or alcohol intake or drugs of unnecessary nature. All that can be factors for delaying pregnancy. The latest discovery for the treatment of infertility is a future science of obtaining cells from the body of a male similar to his sperms, or from the female similar to her eggs, and avoiding relying on the ovary as a source of eggs or source of cells to produce babies, and relying on the testicles for producing sperm to produce babies. That is the future. That is the future, and it's going to happen. The success is very nearby. We only wanted to know where to obtain these cells as primary cells from various parts of the body. But the current medicine is, for the modern fertility treatment, is trying to see whether there is immunological factors causing problems within the couple being able to have a child. Secondly, how can we improve the sperm's quality, quantity, and that's by using a modern, very effective type of antioxidants. Also in giving an intravenous infusions, which I normally give regularly for our patients, to try to improve the quality of the sperms, also the quality of the eggs to be produced well. If we can improve all that, I think success will be within our hands. Antioxidants has been my baby of work for the last 2 years. And I'm happy to acknowledge that I have started this movement of using antioxidants in a way of supplementing, not treating, supplementing the course of treatments. We give it intravenously in a combination of vitamins, minerals, antioxidants, but it has to be combination done correctly for each individual patient. So it's an individual supplement. With regarding to the supplements taken by tablets through the mouth, patients has to understand that the quality of this product has to be well addressed. We have done some studies and we have a products which we know it works very well. We are giving to our patients and we have a great success with it.